Good afternoon, everyone. Welcome. November Dialogues, number 48. The topic is health. I think there is no question why we have chosen this topic. And if there is such a question, the answer is because health is our focus during the pandemic, and many pathogens have been revealed during the pandemic. The value of health may be given, but accessibility to health is not a given fact. I mean accessibility for all citizens and the whole society. And to make it more clear, what is the right to health? The right to health is, as I said, first of all, access to health, accessibility of health to everyone. And of course, this accessibility may depend on the physical distance, but also on another matter of an ethical dimension that has to do with the finances. And this is the economic accessibility of health. And also availability. Is there a health system available? And is such a health system ready and prepared anytime to support society? Of course, quality is also of interest. Quality plays a very important role, and also the appropriate facilities. So let me say good afternoon to Athens and Zurich. We have been connected with three of our speakers for these dialogues. Good morning from me because I'm in the US. So we have been connected from different parts of the world, but this is a common topic for the whole planet amidst the pandemic, which inflicts the whole planet. And it seems that we're in the middle of a new wave of the pandemic, and this is why we are opening this discussion. And you know that we have discussed different things from many different sectors, but whatever we have said is not unique because the pandemic has revealed the pathogens in the field of health that we used to know, but they have come to the surface now. So the value of health and accessibility of health, this is a topic that opens up a big discussion, and it is divided in important categories. Health is not just treatment, it is prevention and protection of health, of society. And another pathogen is the lack of knowledge. I mean, all of us who are not scientists, who are not physicians or nurses or stretch carriers, not working in health services, we are simple citizens, and we may not be well informed. So in periods of crisis, health crisis, such as the current one, we are vulnerable to misleading information. I think I'm clear on what I'm saying because we see what is said around us. And truth is that here in Stavros Niarchos Foundation, a major effort has been made for more than 2 decades in the field of health, not just in Greece, not just in the US, but in other continents too. And I could say, as far as I know, and from my colleagues working in the health sector, donations are around 800 since 1996 to more than 50 countries. So one question is, what has been recorded so far from this experience and from this activity? Where do we stand in Greece mostly? Because the crown of initiatives in the health sector is the well-known Initiative for Health, which started in 2017 with funds which are approximately, and we have here the Chief Operating Officer and the Managing Director of the initiative, Panos Papoulias. He will explain in detail, but let me approximate the number. I'm talking to Panos now, we are colleagues. So it's around $500 million, not just for equipment, not just for buildings. This amount is also allocated to training, education, training for the staff and all people staffing the national health system. It is important to consider, though, also with the assistance of the assistant professor, Mr. Koulouvaris, who is in the first orthopedic clinic at the National and Kapodistrian University of Athens. Welcome, Mr. Koulouvaris. We have met before in dialogues, but not only in dialogues, because you are a doctor in a hospital of reference at the Kon Hospital, and you know very well through your contribution and through your participation in Stavros Niarchos, you are very well aware of the health sector, what exists, what is being prepared, what will be delivered shortly. But it is important to see whether this reaches the final citizen, the end citizen, and this is what is of interest either for citizens or people working in the health sector, because we are all people. We all have a right to health. And we are all potential patients at some point in our life. Mrs. Vallena, thank you for joining. Mrs. Vallena is a professor of bioethics at the Swiss Institute of Technology in Zurich. As I said in the beginning, there is a topic that embraces all other matters, and this is the aspect of bioethics. It may sound very common, but in 2021, the mankind should not still be discussing the fundamental human right of access to health or any services people may have access to, or services that average citizens can receive, because there are still inequalities here and malfunctions. So there is a global debate on many different speeds to consider how this situation can be improved, because improvement is a realistic word. So how we can improve the situation and how we can make health more accessible and more fair and equal for everyone. During the discussion, we will also be joined by Marios Themistokleous, General Secretary of the Primary Health Care of the Ministry of Health, and Mr. Drakopoulos, Co-President of Stavros Niarchos Foundation, because the Stavros Niarchos Foundation has been making several donations, and we are discussing about the importance of the partnership, the dialogue, and the cooperation between the public and the private sector, especially in the field of health. And we have a major example here, a case study, where we can see what works, what does not work, what could work better, of course, with very clear roles of one and the other side. But there are also limits and there are obligations, because not everything can be done by the public sector, and not everything can be done by the private sector either. And we also have people joining us online. You are very familiar. You know how you can send your messages, your questions, your remarks, anything that you want to raise in the discussion. You can ask either speakers directly, the ones we have here already, and two more that will join us later. But we also have 5 students with us, students and graduates of the School of Medicine. Ifigenia Rouzea, a graduate from the School of Medicine. Dimitra Papatheodosiou, again, she has graduated from the School of Medicine. Mrs. Nasiopoulou, a nursing student. Mrs. Kyriakopoulou, postgraduate student of nursing. And Mr. Alexis Vavlas, who is a student in the School of Medicine. Thank you for joining. Thank you for your participation. We are going to have a very active discussion with you too, and we will open up a dialogue among all of us, speakers, those of you who are studying medicine and are getting prepared for coming out in the labor market, preparing to getting out to the field of medicine or nursing, in the current reality, but also with your desires and expectations. So your contribution in today's discussion is very important. Keep your questions, keep your comments, because very shortly you will join the discussion and we will further extend this dialogue on health. As you may have heard, as you may be aware, next June, the annual conference and the entire SNF Nostos Conference and festival will be dedicated to health. We'll be focusing on health. And for 2 days, on the 23rd and 24th of June, we will have the chance to discuss, to wonder, to question, to reflect on several topics related to health, both in Greece and abroad. The modes of communication are well known, but let me repeat, you can find us through social media in our accounts, SNF Dialogues, but also via our email. The platform for questions, snfdialogues.org/questions is open already. You can view the address on your screen, snfdialogues.org, and this is also our email address. Mrs. Vagena, let me start with you. We are the beginning for everything is the right to health. I did mention some key features that we more or less know or perceive, but let me ask you, what is the meaning of the right to health?
Good afternoon. Thank you very much for the invitation. And the basic right to health is a fundamental right, that cannot be removed. It has been recorded in the International Code of Human Rights, and ever since then there is a whole process whereby we clarify what the right to health means. Since this is a fundamental right, every state has the obligation to provide to its citizens the right to care and to protect, safeguard this right. So here there is this obligation on the side of the state. The first time this right was further clarified was through the statute of the World Health Organization, and this clarification, which is important, tells us that what has to take place from the side of the state is to give the citizens the conditions in order for them to enjoy the highest feasible level of health. And this brings us to what you said earlier. We have a specific capacity. Despite that, taking into consideration these restrictions, there is this obligation for us to be able to have whatever we need to achieve this highest achievable level of health, which means that you and I will have a different health level. However, we need to reach the maximum level, each of us. The other aspect, significant aspect of this right is that we should all enjoy this right. We should all be able to achieve the highest level of health. And this actually means that not only is there an obligation by the state to provide the healthcare, which is ever evolving because we don't have the same capabilities nowadays as we did 20 years ago. Not all capabilities are the same in all countries, but also it means that all the other factors, environmental, social factors, etc., are protected, and this allows us as citizens to exercise this right to health. So these are only some of the elements that constitute this fundamental right. There is a dialogue or a debate as to what can be put under the health right, the right to health. For instance, health literacy. Health literacy is something that has been directly associated with the extent to which we can be healthy. Knowledge on prevention, behavior, etc. All these are really significant. Therefore, health literacy as something necessary, and therefore the state has the obligation to promote such health literacy if we are all to reach that maximum feasible level of health. So this is, yes, another important aspect. Therefore, the right of each and every one of us means that we have a biologic potential to reach a certain level, and the state must see to it that we get that kind of care, that kind of education and health literacy, together with the infrastructures, to be able to exercise this right. So if biologically we have made sure that we can reach this highest level of health, what happens socially speaking? You talked about environmental factors, but you also referred to social factors. Yes, this is important. We know, following large studies that have shown that the life expectancy can be defined on the basis of the postal code where one lives, which means where they live. It sounds bitter and hard. Yes, it is, but it is very realistic. The difference in life expectancy between different postcodes might be up to 10 years. Can you please further elaborate on that? Yes, this actually means that people who live in areas with a low socioeconomic and educational level, this is greatly associated with the quality of health and healthcare. This is also associated with their own conduct and behavior, their health literacy, which is directly linked to the outcome. That is, whether they are going to have correct prevention, whether they can have a good quality of health care, whether they are going to abide by medical advice, etc. So when the socioeconomic and educational level is low, the health of people is low. So we see a question that we have already come from roads. A cancer patient cannot have radiation treatment roads. In order to buy only a plane ticket, it takes 150 years, and many families don't have money. Shouldn't road have such departments of radiation treatment, radiation therapy in its own hospital? It's a typical example of what you're actually describing. Yes, we see such differences not only in Greece but everywhere. The data I mentioned come from the UK. There are such differences from that point onwards. Each state, depending on the resources, the infrastructure, etc., has to make respective decisions. But this does not save us from the fact that all citizens need to have access to healthcare, quality healthcare. This is what is important. So in order to improve health, we cannot simply say that we're going to improve this or the other infrastructure in a specific place. In order to improve health of a population of a country, there has to be an improvement of many concurrent factors, and the decisive factors are socioeconomic, environmental factors, etc. Now, listening to the analysis by Ms. Vallena as to how the postal code is the one that defines the accessibility and hence the quality of health services that a patient might have, I come to you, Mr. Koulouvaris, because aside from the rest of your specialties, you are also President and CEO of the NGO Regeneration and Progress. Through your course with the mobile medical units, in fact, you are in a position to confirm and to share with us more information by sharing your experience. You can tell us how important it is to provide such opportunities to citizens of the remote areas of Greece, of insular Greece. We got this message, for instance, from Rhodes, not the very remote areas, or continental Greece areas. Can you share your experience with us? Yes, good afternoon. Thank you for the question. I kept what Ms. Vayana said. The highest level of health and the right to health. These are two significant issues. Let me tell you that back in 2012, before the mobile units program was launched, there was no health literacy in these 26 remote islands, nor was there any health accessibility. There were not rural doctors there. There was not health literacy. People didn't know when they should take tests for prevention, etc. This allowed us to do this crazy thing, which brought us where we are today, 101 missions since 2014. We tried to prepare a group of doctors and nurses with minimum equipment. This is what we did at the Stavros Niarchos Foundation. It was in August 2012, and the approval was given in September 2012. The first mission was in 2014 in Castellorizo. Our experience since that time was that the residents there didn't know what they had to do. We started promoting health and we used the equipment. Of course, what Ms. Vayana said is that things change continuously. So we try to have the best possible equipment close to the residents by promoting health issues, by informing them. Even if we are not there, we have a platform and we let them know as to the tests that they need to take, etc. And we have a medical file. All these inhabitants, we have more than 138,000 people who have to take tests. We're talking about thousands of tests. They visit 2 to 3 specialties, and they have approximately 2 to 3 imaging examinations. So this is a very good example of the partnership between the public and the private sector, because the public sector, for many reasons, would not be able to cover such needs. It's a very complex issue. For instance, Agathonisi, a very small island on the Aegean with only 120 inhabitants. You cannot send a specialized doctor to stay there for quite some time. But on the other hand, the state cannot send specialties, a group of 30 people with nurses, etc., to have the inhabitants undergo a checkup. But we do have this possibility to be there thanks to the Stavros Niarchos Foundation. And we also have the possibility to have access to the public hospital. Therefore, a channel of communication has opened throughout the Aegean. And since 2019, we also have this channel with the mountainous areas. Before I give the floor to Panos Papoulias, I'd like to ask you, because from what I hear, we have a very high number of cases announced today, 8,100 cases. So please tell us about the situation in Attikon Hospital this period, and give us your picture in the midst of the pandemic. How many citizens have been hospitalized, and whether there is this possibility, I mean hospitalized due to coronavirus, and whether they can find beds to be hospitalized in. Well, listen, in Attikon Hospital, the situation is under control. There are some clinics that have been turned into COVID clinics, but the situation is under control. So far, there has been no patient who was in need of a bed and couldn't find it. It is under control. I don't know what will happen in the future. I cannot give you any guarantees. Unfortunately, this system has been turned into a one-disease healthcare system, but we couldn't do it any other way. Regarding surgeries, regarding cancer, infectious diseases, etc., we keep on operating on such patients, and this is a consolation for those who are in dire need of an immediate operation. As I mentioned at the beginning, Mr. Papoulias, this is not a new initiative for Stavros Niarchos Foundation. The latest initiative the foundation undertook had to do with strengthening and grants given due to the pandemic, but we already have 25 years from the establishment of the organization back in 1996, when we had the first actions in the health sector, not only in Greece but in almost 50 countries. In 2017, something changes. Something changed. There was a turning point, and the Stavros Niarchos Foundation undertook the initiative to strengthen the healthcare system of Greece with an initiative that has many different levels. So I'd like to give you time to explain so that we can understand why do we place so much emphasis on health and what changed in 2017 that put Greece on the epicenter. Well, you're right. The first recorded grant for the Stavros Niarchos Foundation in the health sector was in 1996. This was a rather small grant as compared to the data regarding health initiative. This was a grant for a dermatology department in a hospital in Austria, and this goes to show how much we have traveled and how much we have evolved through time in the past 25 years. Now, following the regular grants that have been given in all hospitals around Greece and the world, we have more than 800 grants. Of course, we're talking about 800 grants, but the overall amount for health is much higher than the overall amount given by the foundation, because the donations and grants in the health sector are expensive. It is expensive to train staff and to buy equipment, etc. We're talking about amounts that exceed the amounts given in most grants in other sectors of activity of the foundation, such as education, arts, and social welfare. Of course, all these other sectors are related to the health sector as well. If one sees the course of health grants by the Stavros Niarchos Foundation, one will see that we adopt an holistic approach vis-à-vis the health sector. And this is shown in the support of organizations through time, organizations that had to respond to natural disasters. The support of such organizations had to do with primary health care to people who really needed it, be it the Médecins Sans Frontières or the emergency organization from Italy or other similar organizations. Also, to link this to what Ms. Vagina said, the geographic breadth of such grants is really big. From East Africa for a pediatric cardiosurgical hospital, we go to the establishment of a neurosurgical hospital, to the US and Europe and Asia. So what I'd like to underline vis-à-vis these grants is that some of these grants have to do with the support of primary healthcare services and structures, and some others adopt elaborate approaches vis-à-vis quality healthcare. The pediatric heart surgery hospital in Africa is one on the basis of the best standards, and we've placed it there because it seems that there are many more diseases pertaining to heart diseases in children. So there is a specific rationale behind all these activities. So through this entire process in the past 25 years, we evolved to those of us working for the foundation, either visiting remote areas in Greece with the mobile units, identifying the needs of people, seeing the efforts of doctors, understanding the accessibility problems. We have implemented specific activities that allowed us to develop know-how vis-à-vis the implementation of construction projects, buildings as well. Yes, precisely. Yes, I'm referring to the building of hospitals. Yes. We had the donation of 143 ambulances for Greece. I understand what the gentleman or the lady from Rhodes wrote. So we've proceeded to the grant and implementation and installation of linear accelerators throughout Greece. Not only in Athens and Thessaloniki, of course, it's always difficult to cover all the postal codes of a country, but we hope that to the extent of our abilities, we were able to help patients. One question that comes up is how these decisions are made as to when and to which sector are there going to be any grants. How is a decision made vis-à-vis the location, this postal code or the other postal code, and whether it is also a criterion. Of course, it could go without saying, if you take into consideration how you can provide services to as many people as possible.
Definitely, this is extremely important. It is not a simple question. On the contrary, this is a very difficult decision-making process. The foundation has an open application process. Anyone can log in our system and apply for funding, funding for some action, some activity they have in mind, and they can do that anytime, 24/7. So our foundation receives those funding applications and gets in touch with people and organizations who apply for funding. And then we start a discussion with them to see whether their request is substantiated and whether this is compatible to our capacity. Apologies for interrupting, but it is important and it is worth stating this. I'm saying this as a journalist, but also as a citizen. We keep hearing about donations that are granted, which is good, but sometimes we do not understand what we hear, and we never have any clue what happens afterwards. There's no follow-up. So sometimes we hear something extremely pleasant. We are very pleased for a donation, but in practice we do not understand what this means, and we don't know whether the donation was worthwhile and whether it really serves the purpose. So initially, it is important for any people and local societies and citizens or bodies. It's very important for them to be able to apply for funding, to have access and file applications to Stavros Niarchos Foundation. But speaking of such a major initiative that has to do with projects with the public sector, for example, construction of a hospital. And we would like you to tell us about that and what the Initiative for Health comprises. So how do you consult with the state? Do you construct the whole project and deliver it to the state? For example, who decides where the hospital will be constructed? We will also discuss this later on. Or which specialty needs further training or strengthening, reinforcement by additional courses. This is always done in dialogue with the state and the society. This open process I mentioned before recognizes the existence of the epistemological distance, because we do acknowledge, as Mrs. Vagena said before, that the society and the state do have information about the needs that are out there, and we need to listen to those needs. Of course, we have qualitative criteria in our discussion concerning the applications we receive, both concerning implementation and also follow-up. So we do raise those questions because we want to make sure that the projects will be implemented properly, because this is our duty to the society and this is our mandate. For example, concerning the Initiative for Health, as Mr. Andreas Drakopoulos has said in the past, the president of the foundation, our idea has been to proceed to the construction of a major hospital in Athens. But after our consultation with the state, we realized that even for this major project, we had to take into account, the same as for all other donations, the need for access to health for everyone all over Greece. And in this field of Initiative for Health, it is not a coincidence that the three flagships, those three hospitals, are constructed outside Athens. Not in Athens, Sparta, Komotini, and Thessaloniki. So the Initiative for Health is an umbrella of health donations with 14 sub-projects, 3 key objectives: accessibility, high-quality medical services, and reinforcement of medical staff. And the flagships are 3 of those 14 projects, at least in terms of size and complexity: a general hospital in Komotini, a general hospital in Sparta, and a university child hospital in Thessaloniki. Children's Hospital. So you see that the geographical coverage is as wide as possible. This, of course, involves difficulties in terms of the high-quality construction of projects, because instead of constructing one big hospital, we are constructing 3 hospitals across the country. This is major evidence of our principle, which is accessibility. And we are committed to deliver those hospitals as model hospitals all over the world concerning construction, operation, equipment, machinery, devices. And this evidences that we really take this very seriously. Our cooperation with the Greek state, with the public sector, is very close, of course, which is absolutely reasonable for such major projects, the same as with the linear accelerators that I mentioned before, which pre-existed, but also in this project for the hospitals, we are in consultation with the Greek state, because these projects will be delivered to the Greek state, to the Greek society, for Greek citizens. Those will not be private hospitals, they will be public hospitals and part of the public health system. So it's important to be working together with the future users of those hospitals. Well, another major part, and I'm asking you, Mr. Koulouvaris, is how your community views all these aspects. I mean, the medical and nursing community, all those working in the health sector. especially in the public health sector. Look, this whole effort has been embraced by the medical and nursing world. It's not just state-of-the-art equipment and modern buildings. It is also training courses organized by Stavros Niarchos Foundation. And they are of really high quality because we need our manpower to be ready. As Mr. Papoulia said, there is an effort to work with Johns Hopkins in order for this children's hospital to be affiliated. And there are now training courses both for nurses, the nursing faculty of Evangelismos, for the university faculty, but also for postgraduates. There is also a trauma training course for the first aid rescuers and for those who graduate from the School of Medicine. So there is a global, a comprehensive approach. So in terms of machinery, technological equipment, but also training. I see many questions about education, literacy, evaluation of medical staff. Well, this is something that we have focused on, both in terms of quality and safety, how the hospitals will work, what equipment they're going to have, and how the nurses and physicians will be evaluated, appraised. This has to become true. We, both physicians and nurses, need to be appraised. Well, to follow up on this, the three hospitals are our flagships, but the training courses are also very important, among others, because we have realized that from our activities and our contact with the medical world that hospitals and the equipment are a shell. If they don't work properly, if they are not operated properly by the manpower, they will go wasted. So all training courses mentioned by Mr. Koulouvaris, which are part of the Initiative for Health, are training programs and courses which are really innovative concerning the approach. Infections, for example. This is the follow-up of an older training course on infections that had been funded by Stavros Niarchos Foundation. And it had been funded back then when infections had not been in the focus of our agenda. So this means that all of you working in this sector have to find good listeners. Yes, this is very important. And another example, the donation of ambulances, which pre-existed of our initiative. 143 ambulances were donated with a GPS system, and they could be used more flexibly compared to the existing ambulances. It is not just that 143 ambulances have been purchased. It is that those 143 work better than the previous ones. The same goes for the new hospitals. They will incorporate the new learnings about hospital infections or trauma. They will have medical doctors who will have attended the training courses as those mentioned by Mr. Koulouvaris. So this is a holistic approach of the Initiative for Health, for the provision of health services across the spectrum. And of course, we have to include mental health here too, because mental health impregnates all efforts made by our Initiative for Health concerning the establishment of a network of child psychiatrists all over Greece. And we hope to be able to help them in their work concerning the major needs in the field of children's mental health, not only because of COVID-19, but also because of COVID-19, because this is a topic that comes to the surface every day. So the hospitals we are constructing, especially the one in Thessaloniki, will have a model award for children's psychiatry. This is not very common when you hear about a donation in the field of health. So far, when you hear about a donation, you think about some equipment, some device, a machine that will do something. But here, with the guidance of our board, we are trying to implement a grid, a network of donations that will provide something holistic from all different aspects, even by incorporating architecture and green and how they're going to play a role for the prosperity of the families and visitors and everyone. Mr. Koulivaris wants to add something. Yes, one indicative example is radiotherapy machines. All radiotherapists were trained in the US, and they are being appraised. Although the donation is over, training and appraisal evaluation is being continued. The same goes for rescuers in the ambulances. The active rescuers of the emergency doctors keep being trained, and there is strong interest shown by rescuers. So all human resources in the field of health are thirsty for training and further training. I wish now to give the floor to Mrs. Vagena, because I have a question about the digital era in the field of health. And I'm asking that not because we are all in a digital era, but because the pandemic has forced us to coexist and co-work and settle and arrange almost everything in our life through the digital world, especially speaking of Greece. Since we are now discussing our country, we saw how at last we digitalized things that may have been self-evident in other countries, but have been impressive here. It is true that we were thirsty for digitization. Of course, it was an emergency, but they went digital. So what happens in the field of health in terms of digitization? There was a question that we saw on the screen before about telemedicine. We keep hearing about telemedicine for many, many years. I don't remember how many years we have been hearing how good the telemedicine will be and how it's going to resolve the problem that you raised in the beginning. This is the question. Good afternoon. How can we say that there is access to health for everyone when there are regional medical centers or health centers which only exist as labels, but they are understaffed or have no staff at all? Of course, through sponsorships and grants, and there is a possibility for telemedicine, which allows for prevention but not substantive treatment of emergencies. So at this first stage, do we have telemedicine? Do we have networking, to put it simply? Can we have the basic communication in order to go on with the next stage of our discussion? Well, I hope digital technology can help accessibility, meaning that remote areas and those who do not have physical access could at least have digital access. Well, we have been hearing about telemedicine for years, not just in Greece, but in other countries too. We do not have impressive results. However, the pandemic has brought us much closer to understanding how digital technology can be used, and this is very important. In recent studies, newer studies, especially in the dialogue about public health, the digital factor is considered to be decisive for health. of equal importance as the economic and the social factor. Now the digital factor has been included as equal. For example, internet access, or digital technology literacy on the part of the citizens, and on the other hand, the obligation of the states to make a digital infrastructure available in health areas for such services to be provided. Of course, a surgery cannot be done digitally, but there are so many other services which are essential, especially in the field of prevention, which can take place by digital systems. So digital infrastructure is extremely important. Digital governance is also extremely important. It is obviously costly, but is the cost extremely high? Well, I think the experts should reply to this question. My sense is that the cost is going down, and it is not an extremely high cost. But the most important aspect is digital governance and the legal frameworks, because telemedicine is not just a screen, a monitor, and how we communicate with one another. This can be easily resolved. There is another broad range of issues, for example, protection of privacy, who has access to the data, and so on and so forth. But one positive aspect here is that since other countries have been working on this for several years, we do have good and bad examples. So Greece now could check and see what example could best fit the country. But without the digital aspect, it's difficult to say that health can be improved in general. And it will be difficult to reach equal access without the digital aspect. And there is another important factor. As you said, we live in a digital environment. Even if we leave health outside, we all live in a digital environment. We go on social media, we buy online, and so on. The problem that was revealed in the pandemic is that our health can be harmed by the digital factor because we are vulnerable to misleading information or fake news, which during the crisis, the health crisis, has been more obvious. So digital means many things, from telemedicine, which needs infrastructure and legal status and so on, up to the broader digital literacy, to be able to understand what messages we need to get concerning health and what we should leave out. So one of the most important topics for the future and the present is how to design the health system for the future.
Yes, okay. We are ready to join Mr. Marios Themistokleou, General Secretary of the Primary Healthcare at the Ministry of Health, and Andreas Drakopoulos, Co-President, Stavros Niarchos Foundation. We'd like to welcome you and thank you for your participation. We try to hold a discussion on health, considering all aspects, from the aspect of doctors, the public sector, the private sector, the aspects of other issues, moral issues, etc. Mr. Themistokleou, I'd like to ask for your first comments. I know that you've been watching our discussion so far. So a first comment from you, please. Good afternoon. It's a pleasure and an honor to have accepted such an invitation and to be amongst friends with whom I cooperate on a daily basis, such as Mr. Koulouvaris and Mr. Papoulias, and we have an excellent cooperation with Mr. Vagena. And would like to thank once again Mr. Drakopoulos for the grants by the Stavros Niarchos Foundation. I heard quite attentively, and I was reading the questions that were put by the audience. I'd like to add not an aspect of optimism, but I'd like to put things where they actually are here in Greece. If we talk about the health system or the health level in Greece today, with a very important pathogenicity of the system, Of course, we can have more detailed analysis later on. Some of the pathogenesis will appear. We don't have primary health care. There is no cooperation between primary and secondary health care, etc. However, despite all that, we do have a health system which is open. We might not be able to have a good control over the expenditure, but it is accessible. This can be seen in various indicators. If we compare ourselves to other countries of the EU or even to the States, we have indices and indicators such as the average life expectancy. We are much higher on average in the EU and than the States. There are other indicators as well. Even in a faulty system, we are doing better. Despite the problems of accessibility, there is access to the system. There is access to examinations that are not available to other systems, European systems, etc. They have access to tests, examinations, and technologies. In other countries abroad, there are very strict rules that apply vis-à-vis the access to such technologies. I'd like to stay at this point so that we can enter into a discussion later on, but I'd simply like to conclude with the following. Even in the midst of such difficult circumstances, the national health system, together with the private sector and the grants thereof, and I'm talking about Stavros Niarchos Foundation, changing the map of health to a certain extent, manages to be at a certain level, and it is up to us to raise that level. Mr. I'd like to get a comment from yourself as well, because we have many questions waiting. Unfortunately, Mr. Drakopoulos' microphone is muted. Yeah, I was muted again. This is the digital world we were talking about. Yeah. Thank you very much. I'd like to also thank Mr. Themistokleou for being with us today. I would like to thank all the partners of the foundation, Takis, and everyone. I have two things to say. First and foremost, we are talking about the pandemic and then in general about the health system and the initiative that we try to undertake to contribute. Now, regarding the pandemic, I think that we should all understand that we are at war. Why is that? We're talking about a global pandemic which has afflicted everyone and everywhere. It would be good to try to depoliticize what's going on today, because as has been proven by the COVID pandemic, we were all unprepared. All countries, all health systems were not prepared to deal with that. The German Minister for Health only recently pointed out that after the last wave that Germany is hit with, there are three results. Either you are going to be vaccinated, or you get sick and recover, or three, you'll die. It sounds really depressing, but this is the reality. We are at war. On the other hand, it might sound funny, there's always light at the end of the tunnel, because I believe that we are facing the last wave of this pandemic. If one takes a look, it might sound funny, but if you take a look at Zoom's shares, I don't know about you, but we have been using Zoom today. In the past few weeks, the shares price for Zoom is down by 60%. This goes to show many things. In general, I think that we are getting out of this pandemic. And what have we learned? What are the lessons learned? To me, this is the most depressing part, because I don't think that we have had our lessons learned, and I don't think that we'll be well prepared for next time. I'm talking about the situation around the world. Regarding Greece, I believe that we need to depoliticize the entire health issue. What do I mean by that? Those who haven't understood that we need to have a strong national health system live in a different world. The public health system should be strong in order for it to provide access to everyone, to provide access to a necessary good for all citizens. And this is where we come in with this initiative, which indeed is important. It is quite extended. I believe that sometimes the procedure and the process is much more important than the result. And I expect and have high hopes that we might prove to be stronger in Greece. We undertook this initiative with the Syriza government, and I'd like to thank both Mr. Polakis and Mr. Xanthos, because we started out this initiative together with them in a meeting we held, and we decided where we would go, the future directions. We had excellent cooperation, and I'd also like to thank Mr. Themistokleous, who is there for us on a daily basis. Mr. Themistokleous talked about togetherness. Yes, this is a key issue. This is not a political word. It is a key word. The problems that we are facing, not only in Greece, but globally, have been reminded to us by the pandemic. The pandemic has given us yet another opportunity to get rid of certain problems. We are facing important problems. And when I talk about depoliticization of health, we need to depoliticize the entire debate as to who should contribute. Everyone should contribute. I think that we're proud at the foundation, not only the outcomes and outputs of this initiative, but we are proud of the way with which we make progress, the procedures, the transparency. It won't be perfect, mind you. No one's perfect, but it's going to be the best possible thing. When we had the center, the cultural center, we had said that we hope that this will become an example to shift the way we think in Greece. Have we managed it? I don't think so, but it is something. It is a good indication. I wish I could see the same with the health initiative, and I expect that it will be the same and will come out of this tunnel, of the pandemic tunnel. The thing is to see how we're going to exit it. What will be the lessons learned, and what are we prepared to do as a team? The national health system for the past 30 years, 40 years, has been torn to pieces. Or to rephrase it, it can be better, and we can improve it by working together. Thank you very much. Thank you. Before I give the floor to our students and graduates who are with us, Mr. Themistokleous, I have a question for you. As a representative of the institution, because we need to have an answer from your own lips. Now we have 8,100 cases announced today by the ministry in Greece. And the feeling is that we are going towards a very difficult period. With the figures, the mortality figures, if I'm not mistaken, yesterday we had one of the 6 worst days. We had the highest rate of deaths daily ever announced since the beginning of the pandemic. Yes, the pandemic is here and it will stay, and we don't have a magic wand to get rid of it. We have a huge increase of cases, which is seen in almost every country of the EU. We can see it in Germany, in the Netherlands. We see countries where people have higher rates of vaccination and they have the same figures of cases. What seems to be the case is that there's going to be a plateau. We don't know that for sure. We'll see whether it's going to be maintained or whether there is going to be yet another rise of the cases. Now, with regard to mortality and deaths. Our country, even now, if we see the overall picture, we have good rates regarding excessive mortality rate. This is the rate we should be measuring because we've seen that the way to take down deaths is not a single one in the EU. So if we talk about an excessive mortality rate, Greece remains at good levels as compared to other EU countries. I think that the solution to that is vaccination. We need to convince more people to get the vaccine, particularly those above 60 years of age who are mostly vulnerable. Yes, the truth is that this campaign has not worked very well in Greece on the basis of the population rates of people vaccinated. And we can compare this to the figures of those who are hospitalized either in the ICU or in simple beds in hospitals. Of course, here I think that we need a better analysis of data. We cannot have one common denominator. There should be better clarity as to whether we're talking about unvaccinated population, etc., whether they have underlying diseases, whether they suffer from infections, hospital infections, or infections due to other diseases, patients who get coronavirus in the hospital. This is what had been mentioned by a journalist in a different dialogue session back in spring. It's a different thing to claim that a citizen died to coronavirus or with coronavirus. This is fundamental and it will affect the decision-making process. Now, let's move on to our graduates of the School of Medicine and Nursing. Ιφηγένεια Γουζέα, Δήμητρα Παπαθεοδοσίου, Σταυρούλα Παπακυριακοπούλου, Alexis Vavlas. And I'll start with Alexis Vavlas because we remember, and this is why we sought to find you again, in past discussion we held in February 2019 on the Health Initiative at the Stavros Niarchos Foundation Cultural Center. You had said something, and Mr. Drakopoulos had used your phrase to conclude with the discussion. Your own phrase was used. If there's hope, there is hope for me to stay in the country. So our question here is, where do we find you today? Okay, good evening. The first thing I'd like to say is that all this is quite important for us, and they still play an important part, all these actions and activities. Can you hear me? Yes, we can hear you. Yes, I can hear you. I don't know if the rest of the speakers can hear you. Mr. Drakopoulos and Mr. Themistokleous cannot hear. So it's not from my part. Oh, yeah, we can hear you now. Okay, please repeat. Mr. Vavlas, we are all, yes. So, good afternoon. The first thing I need to say after having heard all that is that whatever I had said back then, a hopeful message, is still there. It is really important to have all that is being done for us, and this is an inspiration. Focusing on the renewal of the Greek health system. What troubles me, though, is how this entire system will be utilized. I'm referring to the assessment and evaluation of trainers. We will have structures created, but the staff needs to be renewed, and it's good to constantly train and retrain. There is an issue right now in Greece, and I'll answer by saying where I am. As soon as I started studying the clinical years of medicine, I came to realize that the training curricula and programs are not very good. They are not well organized, to be honest, and this creates several problems. It's a matter of luck. The thing is that there is no central supervision, and this causes young people to want to leave, because we know that abroad there are many more possibilities for us to train. Definitely, we do have good hospitals, good trainers, but since there is no central supervision of the training programs, it's all up to luck. So if we go abroad, there's a high possibility and probability for us to stay abroad, because people want to invest on us and keep us there. They are organized in that way. I'm looking at the UK, for instance. Things are structured in such a way so as for them to train us and keep us there. So what I'd like to comment upon and conclude with is that we need to have a central supervision, particularly at the university hospital that you are going to build. We need to see that there is central supervision for training courses. That's all I had to say. Thank you.
I don't know if I confused you. I'm not sure I was clear. Thank you very much. It's very important for us because, as you said, we work for you. And when I say you, I mean young people. So what you said makes us very happy. Now, what you described, and I will let the experts speak, of course, has to do, unfortunately, with how the whole country works, not just now, but for the last 30 or 40 years. And this is where we should focus our attention. But I will let the experts elaborate on this. On the other hand, this cannot happen overnight. It needs a proper preparation and building and good partnerships and contribution from everyone. Thank you. Mr. Themistokleous. Just a couple of words. The kid is right. He's absolutely right. And then what? Well, I happen to be a medical doctor myself. Mr. Koulouvaris is also a doctor, so the guy is right. Yes, there is a problem. There is no central oversight, and there is no any central guarantee that wherever you are, you will be trained the same, and you will have the same standards of training. This needs to be changed as soon as possible, because during the economic crisis, this was one of the reasons why young physicians went abroad. And now, instead of having doctors in the waiting list, as we used to have in 2010, we have vacancies. So, yes, we have to change that. We need central training for physicians, not in clinics, but in units. And there has to be training courses, surgical specialties after a certain number of surgeries, according and in compliance with what is happening in other countries. We don't need to reinvent the wheel. The system has been applied in other countries for years. Mrs. Vagena, I agree with everything. This was very important. Recently, we had a workshop, an online workshop on bioethics, and it was addressed to doctors, medical doctors, or trainers. physicians who teach doctors or nurses. And it was an amazing experience because we saw that all those young people, but also those working as physicians or nurses for years, had a strong desire for such a training. Of course, we focused on bioethics, not the clinical part, but we saw that there was a great passion and enthusiasm and excitement and willingness to be trained. This has to be utilized. We needed to train those people properly and keep them in Greece. This is the key. There was a question about the brain drain. I saw it before on the screen. It's exactly the same. All those talented and remarkable people need the necessary environment in order to gain the knowledge they need and make a career and a professional life in order to be able to give back what they get. We don't need to reinvent the wheel. As Mr. Themistokleou said before, there are practices followed in other countries, in Europe and elsewhere. It's a matter of political will and cooperation. Mrs. Nasiopoulou, Theodora Nasiopoulou, has a question. She's a nursing student. Good afternoon. Thank you for the invitation to join this event. I am in Thessaloniki now, although I study in the Athens faculty for nurses. I would like to thank you because you raised an issue which is a major topic for us as well. When I graduate from my faculty, the national health system in Greece allows me to specialize on some specialty, nursing specialty, mental health, social psychology, emergency nursing, and so on. The only specialties that have been opened in Greece in the last years have no central oversight. So whatever hospital you may be in, and depending on the ward, the department, the head of the ward, the trainer. So depending on all those factors, the experience and the training that you get vary. And there are hospitals where you can get the perfect training because the nursing staff is extremely knowledgeable and capable and competent, mostly young nursing staff who are not exhausted from the fatigue of the work. But there are other cases where people would not pay much attention because they say, well, you are still young, we have to see many things, and they just let you see but not do. They do not allow us to get hands-on experience. It is very important for us to be able to be allowed to do things and not just see. Thank you. Mr. Themistokleous, I will ask you and then Mr. Koulouvaris. Mr. Themistokleous, with your judgment and experience as a physician, but also representing the state, the Greek Ministry of Health, does this need political will and coordination and work? So do you need to prepare a plan, elaborate a plan, and or other more difficult and complex aspects? Where it's more complex. First, of course, we need political will, we need a legal framework, we need a training framework to apply, which is almost ready. But then it's more complicated. I guess Mr. Koulouvaris knows better. Someone who is a trainer must be willing to train other people because the framework may be in place, but we also need culture, training culture, as we call it in medicine. And there are other factors involved there. As Mr. Drakopoulos said, it will take us years to change this mindset, this culture. But we have the duty to take even small steps forward. So the first requirement is political will, to have a plan, to put a plan in place, and then the others will follow. And we will manage to get a training culture because it should not depend on people's willingness to train others. So we need a framework. Exactly. We need a framework, and we also need the training culture, and trainers should be willing to do it. Mr. Koulouvaris and then Mr. Papoulias. I agree. I agree. Political will is needed, and training culture is also needed. I agree. The students are absolutely right. Alexis, you are right. Where you will be, where you will be trained. I would say the same, but we need you. We need your ambition. We need your work, and this will help us change our culture. And then I should also be appraised and evaluated as a professor in the university, and not be able to be promoted if I do not have the proper scientific, medical work. This is the direction medicine is heading to, and there should be oversight. We should know that the trainees have received this training. So political will is first needed, and then we should build on this. Mr. Themistokleous, there is a question for you. So you have first Panos has the floor, and then Mr. Themistokleous, because we have to close in a few minutes, so we have to answer the questions. Well, what I'm going to say does not fully cover the questions, of course, raised, which are very correct. Concerning the Initiative for Health and the training courses, there are some courses, such as the one on trauma, that Mr. Koulouvaris is involved. Those are courses with certain protocols, and there is an agreement with the Greek state. After the 5 years, which is the duration of the courses, those will be courses for all students graduating from the Greek School of Medicine. So all these questions were absolutely correct. And with my co-workers, we have taken some notes, and we will get in touch with these young people and take their own views. Because when we design hospitals and programs and courses with all stakeholders, families, patients, and users, this is very important. And those young people here are the end users. So we are taking notes, and we will discuss everything with you. We have 3 questions. One has to do with what Mr. Drakopoulos said before, that the pandemic should have help us learn a lot. But Mr. Drakopoulos, the question says that what has Greece learned from the pandemic so far in the field of health, of course, always. So what is the learning for Greece? Well, I will be optimistic again. Compared to other countries of the EU, we perhaps this time we did slightly better. Although we were in the last places before. Last places in terms of what? Oh, no, we're doing better in terms of what? In the field of the pandemic, because we saw countries and health systems much better than the Greek one brought to their knees. Let me remind you of Italy or the UK or Belgium, because those are countries with more advanced health systems and with funding which is 25 or 30% higher than our funding for the health system. Well, to give you a counter argument, we are talking about different numbers in terms of population. Okay, then let's compare Greece with Belgium, which has a similar population with a very high number of deaths from the pandemic during the first, the second, and third wave. Even in Portugal, there have been periods in the third wave when they had 240, 250 people dying every day. what we are measuring and will be shown in the indicators is that people now trust more the national health system, because the national health system is the institution number one in the country, and it enjoys 75% of citizens' trust. This is not to make us complacent, because I know about the pathogens, but the pandemic has to become an opportunity. The crisis has helped us have more beds in hospitals and ICUs, and Stavros Niarchos Foundation has played a major role here with their grants. So now we have reached the EU average in terms of ICU beds. Yes, but have all ICU beds been staffed? Because this is another question. The ICU beds that could be staffed have been staffed, but it's not possible to do it overnight. You know, you cannot find expert staff overnight to cover all those beds. In terms of material and technical infrastructure, we may be able to develop 300 more ICU beds, but we will not have the necessary staff for these beds. It will take us a few years. This is why in other countries they do not grow the number of ICU beds, because they do not have specialist staff for those beds. I saw a question about medical centers, why we do not staff the medical centers. Well, we needed to change our model in health provision. It's not the fault of the state that those medical centers are not staffed. They are not staffed because it's very difficult for physicians to settle in a place which is remote. We need higher incentives, stronger incentives, or a different system, because there is always a call for covering these posts, but unfortunately there is no interest. Mrs. Vagena will have the floor because she has to go, and then Mr. Drakopoulos. Well, the pandemic, about the pandemic, which was the last point. It is obvious that most countries were unprepared for the pandemic. We have to fight against a very difficult phenomenon. As Mr. Themistokleou said, the point is, and Mr. Drakopoulos also said, the point is to draw learnings from the pandemic. The pandemic is not over, of course, but a very important lesson is health literacy for citizens, and trust in the scientific knowledge, and trust in the health system. And these last two cannot be acquired overnight. It's not that since we suddenly have a crisis, we suddenly gain trust and health literacy. Those take time. So my appeal to people would be to be very, very careful with those two, how we can build that trust and how we can create better health literacy and digital literacy to be able to communicate better when there is crisis. And of course, infrastructures are needed, but these two are very important.
Thank you very much for having participated in this discussion, Ms. Vagena. We expect that we'll hear more about that on our conference this summer on the 23rd and 24th of June within the framework of SNF Nostos Conference. We thank you a lot. Now let's move on to a question to Mr. Drakopoulos that talks about the quality of cooperation between the public and the private sector, but in particular the cooperation between the state and the foundation. The ICU units, whether the foundation is satisfied with the speed of absorption of that grant. Mr. Drakopoulos. Well, I'm not an expert, but I can tell you that we are satisfied because we've had a very good cooperation with the government, and I think that of course, things could be done faster. We always hope that something can be done better, but in general, we are really pleased by this cooperation and partnership. Again, well, to criticize people, well, there's going to be a day for criticism. But as we speak, we're in the midst of a war. So to the extent possible, we need to work all together and join forces. And I go back to what lessons we have learned. As a society, I'm not talking about Greece or the governments, etc. Globally, I fear that we haven't learned a lot. And we are talking about the pandemic with a mortality rate of approximately 1.5%. And it really tore us apart as a society. It tore us apart psychologically, socially, financially, etc. We're talking about a mortality rate of 1%. The next one, and there's going to be a next one, I hope not in a few years' time, but in a few decades' time, could be with a mortality rate of 10 or 15%. What do we do with that? I mean, we need to engage into self-criticism and criticism, but with our eyes towards the future, what will come in the future. I think we were lucky. It might sound harsh. We were lucky because we had a pandemic with only 1% mortality rate. This is the discussion that needs to take place between all those who have leading positions at all levels on the day after. That's all from me. A question which we touched upon briefly vis-à-vis the Health Initiative. So you were explaining about the procedure, and a question we received, if we can see it. It has to do with the hospitals built by the foundation. We have the foundation building a hospital, but do we have the latest technologies? Yes, definitely, and there is a provision for that. The board of directors of the foundation, in addition to the initial amount that it had planned for each hospital, approved the grants for the increase of the amounts in order to include more modern equipment in Komotini. There's going to be a 3 Tesla MRI scanner. There are very few hospitals in Greece with such possibilities. So we're talking about state-of-the-art technologies. And of course, the timetable for the completion of the hospitals project will lead us to place the orders for the equipment at the last possible minute. So the answer to this question is yes, absolutely yes. Let me add something really quickly. We are going to build the hospitals, and indeed, these are excellent buildings. Technology will come. Let us not forget, and this is not something we say by chance, man is at the center of everything. So in the hospitals, there's going to be people, and we have been saved in the public health sector thanks to those people inside who do the utmost. So we need to have training, and training should not be once and never again. It should be continuous, starting from the universities and going on till the end. Mr. Themistokleou, yes, I'll come to you. There's a question to you, whether the Greek state will be able to operate these modern hospitals and have them operate completely and correctly. The answer is yes. We have seen all the terms and conditions that will lead us to operate them. We have specific timetables, and all this is incorporated in law. I'd like to say something. This was a phrase Mr. Drakopoulos said, that the foundation will not substitute the Greek state. And I'd like to say that the health initiative is almost $500 million. It sounds enormous, but the money paid by the state for the health system is much more than that. What the Stavros Niarchos Foundation does is it gives us a further impetus, further momentum. I was really glad to have participated in the design. All this will serve as an example to be imitated. This is what is the main benefit from this grant. We're talking about not only the amount, but all these training programs that will show us the way forward. This is where these grants also be directed, and this is the Stavros Niarchos Foundation, where I do apologize for speaking on your behalf regarding your own objectives, but I think that this is how we should move. A very quick response. We do not substitute the state. We complement the state, always within a spirit of cooperation, with a common goal to have appropriate projects put in place that will help our youth have hope, because hope dies last. But if it dies, no matter how many hospitals we will build, nothing will come out of that. Ms. Kyriakopoulou. Stavroula Kyriakopoulou, postgraduate student of nursing. Hello, thank you very much for the invitation and the hospitality in this discussion. I think that definitely the Stavros Niarchos Foundation should be congratulated, because it has undertaken a large part of responsibility to help. Definitely it won't substitute the state, but in a public health system that in particular with the pandemic, it seems to be very tired. But I do have a question maybe to address to Mr. Koulouvaris. I'm waiting anxiously to follow the trauma workshop. You mentioned telemedicine. We all know that this is a future. Beyond any doubt, in the States, we have even developed ICUs that operate remotely, are operated remotely. Of course, in Greece, we are not at that stage. But at the stage where we are now, do you believe that the already existing staff, personnel can be trained? Since you do have this experience in the Aegean Islands and in remote areas, and where there is digital illiteracy between our colleagues, do you think that we can train the personnel, the staff, to be able to contribute to the health system in remote areas in Greece? Thank you very much for your question. You know that we have equipped these 26 remote islands since 2 years now. There is this equipment, but Mr. Themistokleous, we need to have the political will to assign people who will be on shift from here to help the local population. As Stavros Niarchos Foundation, we had initiated an initiative to offer an ultrasound equipment that would work remotely. I think that we can train personnel. It's not difficult. It takes political will, and we need to have a team that will manage these activities from here, particularly in emergencies, not so much in primary or prevention. And let me grasp the opportunity to say here that we have managed very well the vaccination program as compared to other countries. I I mean, I have in Sweden relatives, etc., and they try to find out where they're going to have the first dose of vaccination 3 months later. Therefore, this vaccination program was excellent. And also the comment by Mr. Drakopoulos, the self-sacrifice of doctors and nurses. You can see them working and putting on the same clothes all over again. I cannot go beyond that. I mean, maybe we join our forces when we have to deal with difficulties. Ms. Jose, a graduate of the School of Medicine. Good afternoon. Thank you very much for this invitation. I'd like to refer to the educational workshops and seminars such as the one mentioned on trauma and the ALS. I'd like to ask how feasible is it to have these run during all 6 years of our studies? Because I know people who cannot afford to attend such workshops later on, and in the future they'll have to tackle such cases, trauma cases, and they won't know how to save them. So I think maybe such workshops should be available during our 6-year studies. May I answer, Ms. Mousdoukou? Yes, of course. Well, the ATLS and the trauma workshop, well, this is an innovation. The Stavros Niarchos Foundation started out this training, and then the Greek state accepted this. I think that this is unprecedented. In this past year, you are going to receive training on a program that the states do not offer to their students. This is an unprecedented case. We established that you have the possibility to attend such seminars. Now, this symbolic price for attending this workshop is purely symbolic, as I said, because, this is a very low cost, and the fact that the Greek state is going to continue providing such workshops is a very, very positive thing. Now, before I give the floor to Ms. Papatheodosiou, concluding gradually our discussion, I have to tell you that I have received tens of questions from different areas in the country, because we were talking about the accessibility of health. There is a question. I hope that you will be able to find it and show it. It pertains to the rotation that we had heard in the past. Now, and the previous leadership, the specialties and the curricula changed. But if there is no staff to train us, what are we to do? Is it ethical for me to be specializing in Tripoli for general surgery and another young doctor being in Athens? Are we going to be seeing the same thing? Are we going to be doing the same thing? Once it was heard that there was going to be rotation in cities and different hospitals, maybe we can raise a higher level for all our hospitals. So would you like to comment on that, Mr. Themistokleous? Yes, it's a follow-up question for Mr. Vlas's question. What we talked about earlier is central supervision and educational center that will include several hospitals, so as for the students who have all received the same kind of training, no matter where they have graduated from. They need to go to hospitals, etc. So still, we haven't implemented it. it is ready. We are going to implement it, but one of the reasons of the delay was the COVID pandemic, because this changes the staff available in hospitals. As soon as we have a time window, as soon as we have a window of opportunity in the pandemic, it's one of the first things to implement. Ms. Papatheodosiou and then Mr. Vavlas, so that we can conclude. Good afternoon. Thank you very much for the invitation. I'd like to make a comment and then put a question to Mr. Themistokleous. We refer to the trauma program. I participated in that almost a month ago. It was an excellent experience. There are other programs that do not pertain to trauma. I'm talking about basic life support that does not require particular medical knowledge, and these have not been included in the main curriculum of the school. In my view, this ought to be part of our training, and maybe they should also be introduced in schools because they would greatly help us save lives, at least maintain lives until the patient is transferred to a hospital. The second question is, you said, if I'm not mistaken, that there are jobs called in several hospitals, etc. I took an oath in July. I've already submitted my application, and I'm waiting for the results. The question is, why do you think that these jobs remain vacant? Bearing in mind that there is a relevant inexperience of young doctors. Despite technological equipment, even thanks to grants by private sector, etc., these cannot be utilized. So what are the incentives you believe that should be provided so that we can cover such vacant jobs? Yes, well, we'll have to see this on the basis of permanent staff or specialized staff for such structures. I mean, this won't be solved with the appointment of rural doctors who play an important part, but the jobs for which there are open calls pertain to permanent specialized staff. I think that we need to redesign the health map and redesign the way with which the needs of such regions are covered, because in the past we've had many structures. Maybe the role of some hospitals should change so that we can achieve a better level of care. And this should also apply for the primary healthcare centers. So what about the incentives? Definitely the financial one is a strong incentive. And in cases we cannot find permanent staff, we need to find a way as a state to provide doctors to remote areas, etc. Of course, taking into account that they need to be flexible, maybe with a rotation scheme, etc., to cover such areas. Thank you very much. Mr. Vavlas. A very brief comment from my part regarding the organization of education. I'd like to say that it is really important for us to have the possibility to also evaluate our trainers, our professors. I think it's of importance. We need to know that this evaluation is reflected somewhere. Concluding, I'd like to say that I'm really optimistic. I'm really pleased and satisfied with my education and training, because in Greece we have excellent doctors, excellent trainers. who are up to date, and I want to believe that the rest of us are also optimistic. Ms. Nasiopoulos, the last comment, the last question, I don't know what you want to tell us. Two things. One has to do with the evaluation, that we need to be able to do our own evaluation of our trainers. I absolutely agree with that. And secondly, what I have remarked and observed throughout this discussion is that in all these questions, in order to get valid and accurate questions, what plays an important part is to have in place quality indicators, accessibility indicators, quality indicators, etc. All these indicators pertain to the organization and quality of health services. And the good thing is that I see that both Mr. Themistokleous as well as the rest of the speakers try to consult scientists who are responsible for organizing healthcare services, placing in the right place these indicators that help us get figures, and on the basis of these figures, make decisions as to where hospitals will be built, how large these hospitals will be, what kind of personnel needs to be appointed for these hospitals, whether we are going to appoint specialized doctors in remote areas. That I think that more emphasis should be placed on indicators, and I'd like to conclude with that. I think that this is one of the most important aspects of if we are to make a decision that's going to change everything. These indicators will provide the answer, and we need to take into consideration to the extent possible and work with these indicators and in cooperation with the scientists who are experts on that part. Thank you. Thank you too, Ms. Kyriakopoulou. The last thing, and then I'll ask for a comment by Mr. Themistokleous and Mr. Drakopoulos. I can't hear you. Yes, you're muted. Can you hear? Can you hear us? Well, we can't hear you very well, though. The volume is very low. Please try once again. Yes. I don't know if you can hear me better. Yes, yes. So as I was saying, Mr. Papoulias mentioned earlier something about mental health. And in the past few years, I've been working actively and I am a nurse. I didn't have the opportunity to directly help during the pandemic, but I know many nurses and doctors who have been in the first line. As soon as we get rid of the pandemic, we will see, I think, a burnout that will lead mathematically to a lower quality of health services. How can we organize this in such a way so as to avoid burnout? How are we going to deal with these people who have seen stressful situations and might have suffered trauma? Mr. Papoulias, you too are muted. We apologize, we can't hear you. No, unfortunately, we can't hear you. Mr. Drakopoulos, regarding mental health. If there's a good thing that comes out from this pandemic, because there are many bad things, this is the fact that we are allowed to speak about mental health easily and understand that this is a huge problem. Because if you are to analyze a problem, you need to identify it and recognize it first. And I think that before the pandemic, mental health reminded me of the way we would make use of the term cancer in Greece. 30 years ago, people would say, well, he has the disease, and they wouldn't even use the term cancer. Now, the same thing was true for mental health. It's a global phenomenon. We know that we need to take care of our bodies. If we have a headache, we're going to take a pill in the morning. But there is no such thing for mental health. We go from one extreme when we don't speak and don't react, etc., to the other one, where people say that it's this person is crazy, etc. So this is a huge area. And as we speak in the Stavros Niarchos Foundation, we focus on that. And we have had this cooperation with this partnership with the Child Mind Institute in New York so that they can cooperate with us through the Health Initiative. And we are planning a lot more initiatives. It is something that pertains to everyone. I don't think that there's anywhere and any place in Greece where there are no mental health issues. The pandemic is here, and it has uncovered all our weaknesses, all our issues. And if there's a good thing in that, is that it's lifted the stigma that was associated with mental health. So as human beings, we need to tackle this issue in the coming years. Again, I believe that at least we'll be able to talk easily about mental health issues and the need to tackle this in the same way we tackle physical health. Yeah, we'll make yet another effort for Mr. Papoulias. Unfortunately, we can't hear you, Mr. Papoulias. Don't know what's wrong. The digital world is not very supportive, so we will conclude. One more comment by you, Mr. Themistokleous. I'd like to conclude with that, the quality indicators that are really important so that we can agree on what we will be measuring, on the comparisons and benchmarkings, etc. If we set a goal, there has been a special organization established to evaluate us so that we know where we currently stand and to know what our objectives are. So it is with this that I'd like to conclude. I'd like to thank you once again. I think that Mr. Drakopoulos is going to conclude. I'd like to thank you for our partnership with Stavros Niarchos Foundation and thank the foundation for what it offers to the national health system. We thank you for your participation. Mr. Drakopoulos, a big thanks, a great thanks to the young people who were with us today. The most important thing is that we keep on hoping. We are here, and this I say, we do our best. We're not perfect. We hope that we will set an example for others so that others can be involved in efforts for the public good. To keep on believing, I believe that despite problems, the cooperations and partnerships that take place are really significant. The problems come to the surface and I think that we've seen people who have shown that with good partnerships we can achieve many things. I'd really like to thank Mr. Themistokleous because, well, his position is not that easy, neither as a doctor nor in the Ministry for Health nor in a government that has to deal with this pandemic. And I'd also like to thank Mr. Koulouvaris for everything he does and the doctors and nurses who struggle every day in very dire circumstances. It is for them that we've been working towards a better society for all. Thank you very much. Thank you all for your participation and this discussion. Maybe this is only part of a discussion. Maybe we'll come back to that and open the discussion beyond the borders of Greece. But as we were saying internally, as we were getting ready for this discussion, the Health Initiative was only a start, but since Greece is a case study, which shows the problems and the size thereof. So we are here and we will continue this discussion that is important for mankind. We've only given you a very small taste with certain figures, etc. It is necessary for us to have all the figures in place, but it is necessary for us not to forget that we're talking about humans, the human fact. I hope that we'll be able to come back with a second part of this discussion that will mostly pertain to the international environment. And of course, as I said earlier, we'll have the opportunity to discuss about all that in our conference within the Stavros Niarchos Festival and this coming summer, June 23rd, 24th. Vis-a-vis dialogues, you know how it goes. With God willing, pandemic providing, we'll see you next month on Wednesday, December 15th. Thank you.